Good morning, everybody. I'm Marie Agbre. I am a medical doctor, pediatrician, and I have a master in public health. I work in the National Institute of Public Health in Cote d'Ivoire. And I had the opportunity to work with EQUIST in 3 countries, in Cote d'Ivoire with Charles the first time. Wow. And after this, I went to Chad to work with UNICEF for the ENAP plan. Every newborn plan. And after this, I went to Burkina Faso, where I worked with Laurette on the investment case of Burkina Faso. So today, I want to share with you my experience on the 3 countries. And what I can say about the background is that maternal mortality, neonate mortality, and infant mortality is an important public health problem in our countries and remain high despite efforts made by the country. The prevalence of this mortality is still high. And now everybody knows the many causes of morbidity and mortality in these countries. We know evidence-based intervention who can reduce this mortality also. And the majority of strategies plan and action plan have a significant gap in the funding to be mobilized. We know also that the majority of this funding come from partners, and we need to move towards the target set for achieving the SDG by 2030. EQUIST helps us to choose the best targets, the best interventions, the best strategies that can give the best impact cost in these 3 countries. So in Cote d'Ivoire, we work for every newborn action plan, in Chad also, and Burkina Faso for the investment case. What were the steps on a ENAP plan in Cote d'Ivoire? The first step is to setting up the technical team for monitoring the development of the ENAP. After that, we had 2 workshops for the analysis of the health situation of the newborn with all stakeholders involved in maternal and newborn health, based on 2 frameworks. The WHO Health System framework with pillars and the result-based management tools also. After that, we have a 3rd workshop with the stakeholders using 2 tools. And at this step, Charo was around, and we use the every newborn tools to analyze the the bottlenecks, and we use also EQUIST with Charo to analyze also the bottlenecks and to develop a scenario for Côte d'Ivoire. And after developing this scenario, I finalized the ENAP plan using all the results of this analysis with EQUIST. In Chad, what is interesting is that we start the analysis of the situation, of newborn situation, with the EQUIST tool. After this analysis, we have also do a literature review and interview of key people in this place. And all these results have been presented at a workshop where we have the stakeholders from the national level and for the regional and district level. And when we have presented the results, the profile of the country, people were very interested, and they engaged to continue the process, because they saw that there is a lot of gap, and they have to find what are the causes of this gap. And now people analyze the bottlenecks with the tool of every newborn, and after that they do a resume of the determinants of intervention coverage with a data sheet. After this, I worked with a team of 10 people on EQUIST to develop a scenario, and with the results of this scenario, we use it to do the ENAP plan. In Burkina Faso, the analysis of the health performance of mother, newborn, and child was conducted by a team, and we have written a document of this analysis situation. And with the results of this analysis, I use the data to put it inside a EQUIST tool. And now we develop a scenario to know what is the best strategies and the most important intervention to use for the document investment case. What are the common points of these three experiences? Is that preliminary health analysis situation by stakeholders in the three countries, using of mixed quantitative and qualitative data, tuberculosis analysis, and working or training with a task force to process and to develop the scenario with EQUIST. Gap of data for all countries, because when you are using EQUIST tools, you need to have data, and in the three countries, it's not all the data were not available to analyze the gaps, the gap. We have no information at the level, at the district level, and regional level also in the EQUIST tool. And we have also need of update data on French version of EQUIST tool. What are the impacts of using EQUIST in the process? The application of EQUIST have contributed to identify the most disadvantaged people, to choose the most strategies with a high impact for the plan, and help to redefine priorities in health intervention in action plan. Impact costs help us to redefine priorities and strategies when it's not cost effectiveness. And now I want to choose two examples about this exercise. What is the impact of choice of more disadvantaged population in Cote d'Ivoire? In the investment case, we have chosen 8 districts, and when after developing the scenario, we saw that for the cost of strategy is less in the disadvantaged population. In disadvantaged population, ouais. And for lives saved, you can see that when it's for disadvantaged population, there is more lives who have been saved per 1 million US. And here, what? I don't. It's not okay. And it's the same thing for the cost per capita, that it's less. It costs less in the more disadvantaged population. And now it's the link impact and intervention. So you can see that For the scenario 2, we have added labor and delivery with access to emergency facility. And in this scenario, with this intervention, we can have most important cost, impact cost. And now you can see the difference. It's almost multiplied by 10, the result. And it's the same thing for the cost per capita. What lesson we can say? Stakeholders' involvement, case success factor in the 3 countries. The availability, reliability, and integrity of the data are conditions that deserve careful attention during the bottleneck phase with EQUIST. Identifying a team that includes people from the national level and subnational level, health information system is fundamental to the credibility and reliability of the exercise. In conclusion, EQUIST is an important tool in country planning. We can save time in analyzing the situation of the country, identify the high impact strategies and intervention needed for the logical framework and the budgeting framework. We need to update database on all countries. Need to train a team of national experts who track the tools database in collaboration with the headquarters team. Strengthen EQUIST tool experts' ability to switch to budgeting from EQUIST generated results. Need to update the environment in French of the tool for French-speaking countries. Need to develop network and partnership with university like the University of Edinburgh. So thank you to listen to me. This is the Cote d'Ivoire, Burkina, and Chad. Thank you for listening.